Hi, everybody. It's Congressman Jamie Raskin from Maryland's 8th District. The number of colorectal cancer cases in people under the age of 50 has increased by more than 50% since 1994. So younger people more and more are getting colon cancer. You know, I'm somebody who I'm ashamed to say was not good about going to the doctor. I thought I was immortal for a long time into my 40s. And I think I was 45 when I started having reflux symptoms, and I went in to get endoscopy, and they said, well, as long as we're going to do an endoscopy, we should do a colonoscopy at the same time. And I woke up and I was surrounded by nurses and doctors, and I said, what's going on? How was the endoscopy? And they said, well, the endoscopy was fine, but colonoscopy, we found something. And then on that day, you know, a day when, everything was going great for me. I have a beautiful family and wife and 2 jobs I loved. I was a state senator and everything. And suddenly I was off to the land of the sick. And I'm just glad that it was caught when it was. It was stage 3, but it was early enough that radiation and chemotherapy and surgery were able to treat me. And I've been a survivor now for almost 10 years. I feel very strongly about this as a colon cancer survivor. I know that early screening works, and early screening is the key to surviving this cancer, because colon cancer is a terrible cancer, but it is slow moving. And if you catch it early enough, if you can detect it, you can stop it and you can turn it around. And there are lots of great new ways of detecting and screening for colon cancer. I want to thank all of my colleagues who signed our letter to HHS in support of this recommended change, and all the scientists and advocates who've been meeting with younger patients and who are pushing for this change. I hope that all of my constituents will take advantage of this new life-saving screening opportunity. Everybody, please be safe, be healthy, and be sure to get screened for colorectal cancer.
Hi, I'm Dr. Darrell Gray, a physician, researcher, and deputy director of the Center for Cancer Health Equity here at The Ohio State University Comprehensive Cancer Center, a renowned cancer center that was recently designated as exceptional by the National Cancer Institute. One of the troubling issues that I have dedicated my career to addressing is colorectal cancer. It's the second leading cause of cancer-related death amongst men and women in the United States. And although we've made great strides over decades in lowering the deaths from this disease, largely due to increased adoption of colorectal cancer screening, there are a subset of people in our community for whom the trend in cases and deaths is in the opposite and wrong direction. Those are people under age 50. And certainly, I've had far too many discussions with adults less than 50 and their families about a new diagnosis of colorectal cancer. Additionally, the burden of this disease is not equitably distributed. It's well known that African Americans tend to present earlier with later stage of disease. And in fact, over 10 years ago, the American College of Gastroenterology recommended earlier screening amongst African Americans starting age 45 instead of age 50. And more recently, the American Cancer Society recommended that all Americans start screening at age 45. Screening helps us to interrupt the continuum from development of a polyp or small precancerous lesion to development of a cancer. We can beat colorectal cancer. Screening is an integral part of that solution.